Professor Nyeka, check your chat, please. Thank you.
Okay. Thank you. Okay. I think we can start now. Welcome, everyone. So good morning, good afternoon, good evening, and welcome to day 2 of the 2026 Nisa Research Week. We're very delighted to have everyone join us today. Very happy to have you all join us today. This is our day 2, and it's a special day. We started off on a very good note yesterday with the day 1. The theme for day 1 was diagnosing the problem, why evidence fails to travel, understanding the persistent gap between research, policy, and practice. And today we're going a step further. Today we're going to be looking at policy, systems, and power. Evidence meets power, navigating the politics, incentives, and decision-making in policy implementation. And we have very special people in our midst today. First of all, we're happy to introduce the moderator for today's session. Just permit me to share my screen and introduce to you a very special person. And that very special person is none other than Dr. Darlington Esiakar. Darlington is an assistant professor in the Department of Behavioral Science at the University of Kentucky College of Medicine. She holds a dual PhD in psychology and in gerontology, and her research uses neurophysiological techniques in identifying early dementia risk in Black adults, particularly Black men. And thank you so much, Dr. Darlington, for joining us and being the moderator for this session. And I'll allow you to take it from here.
Thank you so much, Dr. Nyeka, and good day, everyone. Thank you for joining us today. Welcome to day 2 of NISA Research Week. Today, we are exploring a question many of us confront in our work. What happens when evidence enters the real world of politics, competing interest, and institutional power? Evidence alone rarely drives policy. Decisions are shaped by systems, incentives, relationships, timing, and influence. And today we are privileged to hear from 3 leaders who approach this challenge from different but complementary perspectives: system science implementation strategy, as well as large-scale policy and program leadership. The first panelist I'm going to introduce is Dr. Bo Kim. Dr. Bo Kim is an investigator at the U.S. Department of Veteran Affairs, Boston Healthcare System, and an assistant professor at Harvard Medical School. She serves as the president of the Society for Implementation Research Collaboration, and her work focuses on methods for advancing evidence-based practice implementation in complex systems. You're welcome, Dr. Bo. And the next panelist is Dr. Byron Paul. Byron is Associate Dean for Research and Associate Professor at the Brown School of Social Work, Washington University in St. Louis. His work focuses on strengthening health system capacity to implement evidence-based practices. He co-directs the National Institute of Mental Health funded implementation science and mental health training programs, mentors globally, and serves as the co-editor-in-chief of implementation research and practice. We're glad that you can join us today, Dr. Powell. And the last panelist, but not the least, is Dr. Abimbola Phillips. Dr. Abimbola is a public health consultant, physician, epidemiologist, and acting director of strategic information at the Center for Integrated Health Programs, CIHP. With 15 years of experience in implementation science and surveillance, he leads health data systems and has contributed to over 25 peer-reviewed publications, and 15 international conference abstracts on HIV, malaria, and digital health. Today, he is representing Dr. Bola Oyeledun, co-founder and CEO of the Center for Integrated Health Programs. Thank you, panelists, for making our time to join us today. And I will start off with you, Dr. Kim, asking the first question. So, your work sits at the intersection of systems science, engineering, psychiatry, and implementation research. For many in our audience who are newer to systems thinking, how do you explain the value of a systems lens when trying to understand why policies succeed or fail in practice?
Yes, thank you so much for this question. So I often explain systems thinking by sort of trying to contrast it with what I call maybe linear thinking. So in linear thinking, we tend to assume that if we introduce a good policy, then the desired outcome should naturally follow. So policy A should lead to outcome B, but then the real world implementation really rarely works that way, I would say. So health systems or education systems, social service systems, they're very complex and quite often adaptive systems. So multiple actors are interacting very simultaneously, responding to, let's say, different incentives or constraints and one another's actions. So the systems lens, I think, really can help us recognize that outcomes really emerge from interactions rather than from just individual components. An example may be a policy can be designed to improve, let's say, access to care, but whether it actually succeeds may depend on staffing levels or leadership priorities, information systems that may be available, or structures for reimbursement, what's considered a norm for professional behavior, and then of course trust among the community. So each of these many factors may very well influence the others. So it appears, to be a failure of policy may actually not really be the policy itself, but perhaps, let's say, a mismatch between that policy and any of these influencing factors. So I think systems thinking really encourages us to kind of think about not only whether a policy itself works or is evidence-based, but really how the broader system that it enacts and is enacted within can really amplify or on the converse, like dampen or distort sometimes the policy's intended effects. So implementation researchers, I think we think a lot about this. I think this perspective is really valuable as it shifts the attention away from sort of isolated barriers toward really understanding sort of the relationships and interactions between the different components and patterns across the system. So policies succeed or they fail, really not because of just their own design, but I guess the systems thinking really tries to view it as because how they then interact with the other system components into which these policies are introduced.
Thank you so much. And I love the fact that you highlighted that intersection of factors that we typically will overlook when we're thinking about systems. And so, Dr. Paul, much of your work focuses on implementation strategies and improving quality of care through better methods. In your view, where do implementation strategies intersect most directly with policy influence?
Yeah, so first of all, thank you for the question and thanks so much for the opportunity to be here. Great to be back with the Nisa crew and to connect with all of you. I'm going to shamelessly steal from a colleague's publication on this front, as I think it's really helpful. And this is from Jonathan Pirtle and colleagues' paper titled "4 Very Basic Ways to Think About Policy and Implementation Science." I think they sort of really do a nice job of pinpointing, at least on a basic level, ways that we can think about sort of policy and implementation science, but also how implementation strategies intersect with that. And the first way that they talk about is policy is something to adopt. So literally, like if we have an evidence-based policy, how do we get policymakers to adopt that? How do we interest them in that, change their behaviors such that they participate in the policy making processes that would increase the adoption of that evidence-based policy. So examples of like sort of implementation strategies or approaches on that part could be things like audience segmentation and actually disseminating different messages on policymaker engagement with evidence. So and so that's one way to think about it. Another way is really thinking about policy as something to implement and really thinking about the entire implementation process of a policy. So the goal there is to really generate knowledge on how the rollout of policies can be optimized to maximize benefits, right? So example studies thinking about things like describing processes through which the policy was implemented, the extent to which it was enforced, the actors involved with implementation, or even identifying implementation determinants or mechanisms through which implementation processes affect our ultimate outcomes of interest, and assessing perhaps implementation strategies aimed at improving policy implementation outcomes. So I think that's another way that we can think about the intersection. Yet another way is really policy as context to understand. So there we're kind of thinking it, as really a fixed determinant of implementation outcomes and really in the background. And so the goal there is to really understand the mechanisms through which policies affect the implementation of the intervention and how strategies might be selected and tailored to address different policy contexts. And I think this is really consistent with thinking about things like the Consolidated Framework for Implementation Research or EPIS, and thinking about how those determinants might come into play from a policy point of view. And then the last is really policy as strategy to use. So how can we actually leverage different policies or financing structures as implementation strategies themselves? So in sort of the expert recommendations for implementing change, this could be things like mandating change or different financially focused implementation strategies that we might leverage to promote the use of evidence-based interventions or practices. So I think, again, this might be an oversimplification and there's probably overlap between these categories, but multiple ways that we can think about implementation strategies influencing policy or being influenced by policy.
Thank you so much. And one of the things you said, again, that I feel ties it all together is the need to maximize benefit, right? And, making sure that at the end of the day, that the benefit outweighs everything. Okay, Dr. Phillips, on behalf of Dr. Yeludun and drawing from her extensive experience leading large-scale health programs and engaging in policy development in Nigeria and other resource-constrained settings, could you share what her work and experience have revealed about how policy decisions are really made in practice beyond formal processes and official frameworks? Is he with us? Oh,
Yeah.
yes. Yes. Are you
Hi,
on
Dr.
mute?
Phillips. We can't seem to hear you. Dr. Phillips, we can't hear you. No, we can't hear you here. Yeah, we know you're speaking, but we can't hear you.
We see you though, but we can't
Yeah.
hear you.
Would you want to log out off the meeting and log back in? Okay.
Is it logging?
Okay. Yeah. So okay.
I guess I'll move on we'll circle back to him just to keep us active before. Uh, Dr. Kim, I'm going to come back to you with a second question, right? Implementation often happens within complex adaptive systems where multiple actors influence outcomes. From your perspective, how can implementation researchers better map power, feedback loops, and unintended consequences before policy rollout?
Thank you for that question. I'm glad we're getting the opportunity to think together about this. I guess one lesson from implementation science might be that many implementation challenges are quite predictable if we're able to systematically examine the system before rollout. Now that's much easier said than done. So too often, I think we focus primarily on the intended outcomes, intended users. I don't think we spend as much time, perhaps, at least traditionally. Now we're doing this more and more, but I think we don't spend as much time understanding who really holds the influence, whose behavior must change, and then what types of incentives different stakeholders might be facing. So I guess in terms of implementation researchers, how to think about better mapping power, feedback loops, and I think you mentioned unintended consequences before the rollout. Perhaps there are a few questions that we as researchers can ask. So one is, who really has the authority to make the decisions? The second could be, who has the ability to sort of facilitate or block implementation? And then a third question could also be, who will then experience sort of the consequences of implementation? So these answers are sometimes the answers could be the same across one or more of these questions, and then sometimes they're different. So I think asking these could be helpful, and sort of mapping, systems mapping approaches can sometimes help visualize these relationships. So there could be a causal pathway way of looking at sort of where stakeholders are mapping and what kind of revealing feedback loops might exist between people who are implementing the policy and those who are actually experiencing the consequences. So I think the feedback loop concept here is actually really important, because interventions, I think, can change the system itself. So, for example, if you introduce performance metrics, they may be able to improve accountability, but then that can also create other incentives, let's say for gaming the system or selective documentation because you want the performance metrics to look good, or shifting attention away from kind of the unmeasured activities, right? If you say that these are the important measurements. So these are all influences that I think any intervening with the system can actually have on the system itself, and it's going to be continuously changing the system. So I think this concept of feedback loop is really therefore important. And these are not necessarily implementation failures if the system ends up being impacted in that way. I think they are, normal. They can be considered to be sort of system responses. And then I guess that brings us to thinking about a valuable, a question to be asked additionally is, if this policy works exactly as intended, what new challenges might emerge? So that's sort of thinking beyond that first sort of linear, implement this policy and get to the outcomes. But really, by doing that, how is it actually feeding back into the system to change the system itself? So I think thinking about these unintended consequences, intended consequences before implementation really allows us to sort of build sort of a monitoring approach to be able to think about the system, think about what to look out for, and try to detect if possible. So after all, systems do not simply just, receive policies, right? They respond to them. So I think that system response concept might be helpful to think about when trying to do the mapping.
Thank you so much for sharing that with us. Do we have Dr. Phillips back now? We still can't hear you.
Yeah, your audio. No, we can't hear you, but we
can't
can see you talking, but we can't hear you. No. No.
We
No,
still can't
we
hear
still can't
you.
hear you.
Technology. It makes it all fun, I guess. All right. While we are waiting for him to figure it out, Dr. Paul, I'll come back to you with a second question if you don't mind. Um, Policies are often written broadly, but implementation requires specificity. How can implementation science help bridge the gap between policy intent and what frontline teams are actually able to deliver?
Yeah, so I first of all, I texted Bo yesterday just to say I cede all of my time to her, and I could easily say what Bo said to her last response to answer this question, as I think my initial thoughts were actually somewhat similar. I think I've been in this situation where someone describes a policy to me, and I don't actually understand what it means. It's all very vague and hand wavy, and so usually from an implementation science perspective, the first thing I would say is like we really need to define the policy and define what changes are needed behaviorally
Right.
at multiple levels. And so really kind of the who needs to do what differently according to this policy. And that's both with respect to the policies and interventions that are being implemented and with respect to the implementation strategies we're using to implement them. And so I think when it comes to implementation science, maybe there's no one perfect tool, but oftentimes, if it's an intervention that's being implemented that's unclear, I point people to things like Tidier or the template for intervention description and with replication and replication, which is really a framework for how do we kind of describe the key elements of an intervention.
Mhm.
But the idea is kind of like we need to put meat on the bones for an intervention or a policy, whatever it may be, before we actually know how to implement it appropriately and how to monitor that. And so I think we have tools for that. We have tools for specifying and reporting implementation strategies. And then more broadly, I'm going to be a broken record on this, and I think Bo is already getting to it, but this idea of thinking mechanistically and really having a theory of change of how this policy is supposed to work, ideally. How are the implementation strategies supposed to work, ideally, to move that into practice and impact, and really thinking sort of about what the theory of change is for both is, I think, really important. I think in addition to that, when we think about can we actually get quote unquote frontline teams to be able to deliver at? I think that's where approaches like participatory design approaches, human-centered design approaches that actually say like, okay, what are the actual constraints and limits that would hinder our ability to actually do this in practice are really important. So bringing those perspectives in as early as possible, as we really define the intervention and the implementation strategies, I think is critical. And then I also had this notion about unintended consequences. I think that to me is a natural follow on to the mechanistic thinking is like, okay, if this is ideally how this intervention is supposed to work, what are the unintended consequences? And you've worked with a number of colleagues to start trying to think about how to define that. I think there's a lot of interesting work in the implementation science field, particularly as it applies to different policies, where there really are adverse effects of seemingly great policies to promote evidence-based mental health or colorectal cancer screening, or these things that might be good things in and of themselves, but oftentimes the incentives are not necessarily promoting only good effects. And so I think setting up systems to monitor those unintended consequences and really being aware of them early in the process and throughout the implementation process is quite important.
Mhm. Thank you so much. So what I hear from you and Dr. Kim is that is important to think about participatory approach and also to bring these perspectives early on, that it is not something we wait for the last minute to start thinking about. You have to think as you're conceptualizing your intervention and whatever you want to implement, you have to put all of this into consideration as you're making those plans. You have to think about it alongside the system. Thank you so much. Do we have Dr. Phillips back now? Hopefully,
Yes,
third time will be a
yes.
charm.
I'm sure you can hear me now. And
Okay,
I apologize for
that's okay. It
the technical
happens.
issue, but I got my team to help me fix it at the end of the
That's
day.
okay.
So
All right.
I'm sorry for that.
No
So
need for
remember the
apology.
first question? Are
Yes.
we going back to that first question?
Yes, let me ask it again. The question was on behalf of Dr. Yeludu and
Hello?
drawing from.
I can't hear you anymore.
Oh,
Hello?
can any other person hear me?
Hear you anymore?
We
Oh,
can hear you.
then it's on his end.
I can hear you. Yes.
I can't hear you. Yeah,
Oh,
it's frozen.
it's can you hear me now?
Yes, I can hear you. I think the network is a bit unstable from this end, but now I
Okay.
can hear you. Yeah.
All right. Yeah. Okay. So as I was saying, on behalf of Dr. Yeludu and drawing from her extensive experience leading large-scale health programs and engaging in policy development in Nigeria and other resource constrained settings, could you share what her work and experience have revealed about how policy decisions are really made in practice beyond formal processes and official frameworks?
Yeah. So thank you very much for having me once again. And I'm speaking on behalf of my CEO, Dr. Paula, who has had extensive experience in, as you said, in public health, especially in implementation research in Nigeria for many years. And also I've been part of some of those works and been able to learn from the way my experiences and the things which which I'll be sharing. And I think just some key points, first of all, that I would say about the issues that frame policy adoption from evidence. That some critical factors that always need to be considered, and I'll be showing them in some of the works that she has done, to show you how we navigated through these such issues. And then one thing that's very important for evidence to be taken up by policymakers is the credibility, the trust of those who are involved, the trust by the policymakers of those of the research and those who conducted or who are conducting the research. There's also the need for a good relationship between the all relevant stakeholders. It's known that policymakers are likely to listen to you or even entertain researchers if there is already a formal relationship between them. And so you don't want to talk to a complete stranger. You don't want to just come up and, even no matter how brilliant a researcher is, and is presenting his findings, if you really don't know so much about the person, it's different from someone you know, have a stack record, you have a relationship. So relationship or coalition with stakeholders is important. And then the trust is it's important. And part of the trust is there's also always that reluctance. There's always that reluctance to take on a new innovation, to put in a new practice. So I just mentioned all those as some of the factors that impede on evidence adoption into policy. Now, how does the experience come into it? Now, Dr. Bola has been involved in several projects. For instance, we have the Leopard, the Leopard study, which was a study that looked at positive deviance as an innovation, as an innovative intervention to drive immunization among those children. And there was ample proof and evidence that innovation was able to actually double immunization rate among zero doses. This was done in Niger and in Gombe in some a few years back. And based on because of that evidence that which we had, we were able to engage with other potential funders who were willing, to take this to another scale. And another example I'm also going to show, which also shows and talks about the relationship I mentioned earlier, is our relationship with stakeholders, like I mentioned the Ministry of Health, for instance. a particular project we did was the group antenatal care, which we implemented in Kaduna. Group antenatal care from the beginning was able to was going to take up from the start because we already had a structure in Kaduna for over years. We have been implementing under the PEPFAR CDC HIV response program for many years in Kaduna. So because of our relationship with the MOH, the Ministry of Health at that time, it was easy for us when we started the group antenatal care, which was funded by Bill and Melinda Gates Foundation through TA Connect. From the start, we had a very good working relationship. The states from the beginning were part of the whole process. So from it was not difficult for them to co-own the whole project, which was included about 233 facilities. And just to end on that note is that a very positive effect of that relationship with the MOH was because of the earlier adoption. Even after the project ended, after about 2 years, they were able to go on and to scale up to other facilities in the state. The beautiful end of it is that this also proceeded to the Kaduna State Ministry of Health went on to recommend at the National Council of Health, that group antenatal care should be adopted, at the national level. And this was something that was put to the National Council of Health and was adopted, and has become, a policy at that stage.
Thank you so much for sharing. One thing that I guess tied up all the work that you described was the importance of relationship building and maintenance when we're doing implementation science work. I'm going to put you on the spot again with another question because we lost you. And I've already asked our colleagues 2 questions. So I'm coming back to you with the second question. Drawing on your organization's extensive experience implementing major national and donor-funded health programs, what are some of the most common political and system-level barriers you've observed that hinder the translation of evidence-based policies into routine practice?
Yes, thank you very much for that question. And I'm going to start by responding by by research that was done by Nisa. Nisa itself, during the Nisa conference, and this was done with a nominal group, done by the nominal group technique, which was to ask stakeholders about what they think are barriers to evidence uptake in Nigeria. And one of the very important barriers that was mentioned was misaligned incentives. And that's between policymakers and researchers. So researchers and policymakers, they are like on different lanes most of the time. The researchers are pursuing their own career, especially academic. Let me say academic researchers, especially because they are the ones that do research most of the time. And most of them, they are just interested in want to publish papers, career growth within the university systems, and many times the incentives are different. The policymakers are looking for implementation, which they are more, which they think are going to define the time when they are in government. So there are 2 separate things. So that has always been different. And one of the things this has been trying to do is to bring together, a platform for this group of people to come so that they understand they are going to speak each other's language more. Another problem in Nigeria, and which is very important, is the instability of government. If you think about the fact that the policy there's an evidence about an intervention which has gone to a lot of levels up to policy adoption, and just at the beginning of the implementation, it has to stop, either because there's a change in government and therefore and if you look at the BCH, we have the basic healthcare provision fund, for instance. If you know the history of the fund, you see that there was a point when it started, it was halted for political reasons before it started again, and it's ongoing. I'm also going to talk about the fact that we don't really have a structured mechanisms for researchers and policymakers to sit down together and to be able to work together. This will also, if we can have more structures for their convening. Nisa is a very good example, but Nisa takes place only once in a year.
Yeah.
Takes place in a year where it brings people together. If you can have more people coming to sit down together, if we have more opportunities for researchers on one end and policymakers to come together, speak the same language, understand and align their interests, then it will help more, to be able to break through this barrier of, getting evidence all the way to enactment or implementation. Yeah, that's all for me. Thank you.
Thank you so much for sharing that and reminding us of the real-time, real-world barriers that implementation scientists can face when doing their work. But we'll continue moving forward and hoping that all the work we do again, that the benefit stays and we figure out how to navigate all of these challenges. Because I don't think we ever have an implementation science world where we will not encounter challenges, but we'll keep trying to figure out innovative ways to navigate that and make sure that our work is at the forefront and beneficial to the people we're targeting and the population we're hoping to make their lives better. Dr. Kim, and I guess any other person can also jump in to respond to this question. We often say context matters, but context can feel abstract. How can researchers move beyond simply describing context to actively designing implementation strategies that respond to political and organizational realities?
Thank you for this question. I think it is one of those most important, I guess, continued frontiers in implementation science. So yes, we do often say context matters, but I guess traditionally work often stopped after identifying kind of the contextual barriers and facilitators. So I think the real question then is how to use that information to be able to then shape, for example, implementation strategies, as Byron was mentioning earlier. So in my view, I guess context should be really treated as kind of a design input, right, from the beginning, rather than sort of background description. So let's say if leaders are concerned about competing priorities, then implementation and strategies should be designed in a way that sort of helps align the policy with those priorities. And then let's say another hypothetical scenario could be if the frontline staff face workforce shortages, then strategies, once again, can be designed in a way that can help minimize the burden that comes from that, and then if possible, simplify some of the workflows. And then I guess if let's say the decision-making authority is decentralized, then it's important for strategies, once again, to be able to be made and designed in a way that can focus on more local adaptation and relationship building, as was discussed earlier, rather than fully just standardized across everywhere type of mandates. So in other words, I think implementation strategies should be responsive to context rather than kind of being always just on the side of being imposed onto the context. And I think this is where sort of that participatory approaches we were talking about earlier could be so important. I think different perspectives are not just simply sources of information, but in a way they can be really thought about as co-designers, co-producers of these implementation approaches. And I think some of the strongest implementation efforts can therefore be often those that can kind of preserve that sort of core intent of a, let's say in this case, a policy, while adapting the implementation processes around that to be able to really fit the local realities. And I think that balance between staying true to what the core intent is, so like the fidelity, and then balancing that with adaptation probably is where implementation science can continue to provide hopefully substantial value. And so the goal really isn't to just overcome context. It really is to bring it in as design input, and move forward in helping to design the specific strategies needed.
Thank you so much. Dr. Paul, so this question is for you. And again, any other panelists can jump in to respond to it as well. Researchers often generate strong evidence, but policymakers may be responding to timelines, incentives, or competing pressures that differ from research priorities. How can researchers package or position evidence so it is more attractive and actionable for decision makers?
Yeah, and if I could take the prerogative to just to weigh in on Bo's question as well first,
yes.
and then I'll skip to that. But I think totally agree with everything Bo said. And I think actually Bo and I are on a paper with Elvin Gang called "When the Parts Are Greater Than the Whole." I can put in the chat here in a minute. But how understanding mechanisms can advance implementation research. And again, I'm going to sound like a broken record here, but thinking mechanistically, I think has helped me at least to think about context differently, in the sense that context is not so overwhelming. Like, it can often seem like this list that's a mile long of barriers and facilitators and contextual elements that could possibly influence implementation. And when we think about really how and why interventions work and how and why implementation strategies work, I think it points to certain contextual elements that are likely to be really instrumental in influencing our ultimate outcomes of interest. And so again, we just encourage people to sort of move towards that way of thinking, so that we're not necessarily just always saying context is queen and it's everything, and being sort of overwhelmed by contextual elements, but that we actually can pinpoint strategies to that. And then in addition, I would just say this whole notion of tailoring implementation strategies is I think a thorny issue for the field, and sort of how do we tailor, when and why do we tailor? Should different sites get different strategies, or can we sort of have more universally designed implementation strategies? I think is an ongoing issue for the field. Sheena McHugh and colleagues just recently published a Cochrane review on tailoring interventions or implementation strategies, which you can also put in the chat. But I think there's a lot of interesting sort of conceptual questions there about how we best design and tailor implementation strategies, and methods like intervention mapping and evidence-based quality improvement and others that are really systematic approaches to doing that I think would be great to explore with this group. So moving on to your actual question, thank you for allowing the sidebar. I think, again, some of this will be redundant. I think actually, Dr. Phillips raised so many important things about trust and partnership and actually knowing who we're working with. And I think the role of that, the first thing that I was thinking about is really partnering early with policymakers to understand the type of evidence that they need, and ensuring that we're already positioned to take the results of our research and rapidly apply them in their system. And so really, again, just designing studies that are responsive to policymakers and partners up front. Again, I think that the integration of things like, when we actually go to translate results and findings, the integration of things like human-centered design can be important, and maybe designing and packaging our results more attractively. I think the other thing that I was wrestling with was becoming comfortable with what we know now while communicating the limitations of our evidence and the ever evolving nature of science. So I was thinking this notion of sort of distrust in science and, hey, wait a minute, yesterday you said it was this, and now you're saying it was this. Thinking about things like COVID and the evolving evidence on that front. So I think there's some element where, as researchers, we tend to be too cautious about what we know and maybe not sort of at least framing our results, including the limitations of the science, but also being bold about what we do know now. And so I think that's important. We have a colleague, Ronnie Elwey, who was spent the last year sort of embedded in the federal government in the U.S. And one of the things that, I don't want to misquote her, but one of the take homes from her experience to me was like, man, do they want evidence fast? Like, you get hours, not days, to deliver the evidence that policymakers are looking for. And so even if we are partnering with policymakers and really developing relationships on that front, I think we're often going to be tasked with coming up with answers much more rapidly. She also noted that people don't have time to read the articles, the books, etc. So really getting the results of our research into summaries that are widely available through either publicly accessible sources on the web or databases that these folks are looking in is really important. So I think, again, that's not comfortable for me as a researcher. Like, I'm a little bit more slow and plodding in how I think, and but it seems like, at least on some front, we don't have the luxury of doing that. And so if we really want to have immediate policy impact, there's a need to translate this much more quickly.
Okay, thank you so much. I do have a follow-up question, and this is for the three of you, based on what you said, and also what Dr. Phillips said about ever-changing governments, given the Nigerian context. And this question is tied to how do we then package or position evidence that it is not just attractive to the current government, but also attractive to the incoming, or whenever the government packs up and leave the next that comes in, that it is still attractive to that incoming government to make sure that that intervention or whatever it is sustainable beyond just 4 years of government, of that specific government, if that makes sense. Anybody can take this. I know, I'm sorry for putting you all on the
Okay.
spot, but I was just listening to
Okay. So let me try. Can you hear me?
Yes, we hear you.
Yes. Okay. So that's a very important question. And I was just thinking on the spot as you were asking the question. And what came to my mind is, when you think about, we've been talking about aligning interests, the interests of the researchers with the interests of policymakers, right? I'm talking about
Yes.
that alignment. Now, but
Yes.
when you now think about the fact that you just mentioned the instability in
Yes.
government and all that, it means that whatever has to be the reason for, for the research, for the evidence generation, for sustainability, must depend on the people that need this, because they will always be there. And one of the things I found out is that one of the reasons why a politician will be interested in a research, evidence from research and taking it into policy is because it's something that he needs to attend to, because if it's not attended to, the people will cry. So from the cry of the people, which is persistent, which enforces a political incentive to attend to that, if I'm just thinking, if we can base our research based on the needs, relevant needs, persisting needs, important that constitute great burdens in the community, which cannot go away, which cannot run away, no matter who is in government, you're always faced with this. And now there's something you can implement, which you can become the savior of the country as you continue to run it. I'm just thinking that might be a way to go about it. Thank you.
Thank you so much. Yes, Dr. Kim.
I cannot agree more. Thank you for sharing that, because I think it really is about going back to what the essence of the issue is at hand. And I think it comes down to the people, it comes down to the health and well-being. So being able to sort of focus on that, I think, is definitely an important priority when trying to appeal to different leadership, changing governments, etc. I also feel as a researcher, and we, as was mentioned when I was being introduced, I work for the Department of Veterans Affairs. So we are constantly kind of trying to understand where the latest priorities might be, where the changing priorities might be. And one thing that my colleagues and I are learning is it starts all from really, truly understanding what is behind sort of what is put forth as the new policy or the new way of doing things. Oftentimes, just as any leaders in the world may feel the same, or any organizations, businesses, etc., making a mark, I think, is important for kind of what they are pushing forward. But when we're able to center on the individual, center on the people, then actually, like, beyond some of the words that may be used or new ways of portraying something, it can still come back to, I think, what is core. And we try to learn, therefore, what the new kind of leadership might be thinking as much as possible, and then try to see how to map best the real health-oriented, still people-oriented things as best as possible to the new priorities and policies that are laid out. Oftentimes, we are able to find some pathway to that. Yes, it takes time and it takes sometimes reformulation that sometimes may be easier and sometimes may be harder. But I think it's about understanding that once again, everything's at the core, and then also trying to see how best to map to the new priorities and policies that are laid out.
Thank you so much for sharing that. Dr. Paul, do you have any 2 cents to add?
I don't think so at the moment. Thank you though.
All right. Thank you all for indulging me with that question. Dr. Phillips, what advice would you give to early career African researchers who want their work not only published, but actually used to shape policy and improve health systems? Oh,
Hello? Can you hear me?
yes, yes, I
Okay.
hear.
So for
Oh.
early careers, so for early career researchers, right? The question is about early career researchers, right? Okay. All right.
If you don't mind, can we pause on that question for now? Let me ask you another question leading up to that, if that's
Okay. All
okay.
right.
All right. All right.
That's fine.
Thank you so much. All right. So
I just
before
wanted
that,
to,
yes,
yeah.
I know, I see that.
Okay.
Okay. All
Okay.
right. So for this question, for researchers and implementers in this room who want their evidence to influence policy, what practical steps can they take to engage policymakers early and build trust before dissemination begins?
Thank you for that very important question. And, it became even more important to me recently when we were working on the protocol recently. And towards the end of the protocol, the end part of the protocol, we have a section that we were talking about how do we dissemination plans and sustainability plans, and that section, we talked about how we're going to engage stakeholders very early. We talked about how they're going to be involved in terms of how we're going to convene some, we're going to ensure that we have groups, advisory groups, that constitute that are taken from different stakeholders, including money policymakers, who will be part of the whole process throughout. So I can really understand the importance of that question because we actually, included it in the part of the protocol we're developing. Now, the way it works is that one should not just, the researcher should not just sit down and just sit down and just frame what they think they need to give they need to, to produce as new knowledge or as evidence, which they now want to go and shove down the throat, to use that word in quote, to shove down the throat of policymakers that, see, this is what we are giving to you, and you should take over this, and it's good for you, it's good for the people and all. But they need to be part of it right from the policymakers and relevant stakeholders have to be part of the design from the beginning. So in the design of the protocol, you need to make room for their participation. The question, the research question, how relevant is that research question to the to the would-be users of the evidence when it is going to come out? What role are they going to play in design of the implementation, the design of the implementation of research itself? There's a word that keeps coming on often. Anybody who is doing implementation science research and designing the research, there's a key component that keeps coming up recently, and that's co-creation. So there's a lot of co-creation. So there has to be that co-creation design in terms of many components of the plan for the implementation of research. So let me just start from that. Right from the onset, from the protocol, they have to be part of the whole design. Then it's also important that, and this is related to this, we talk about stakeholder mapping, but we need to understand there are so much that importance of knowing who, and that who is very important, and that speaks to power, that speaks to influence, that speaks to people who are going to really support this work that has to be done, who actually needs it. So that's another thing that needs to be taken into cognizance. I'm going to mention something just before I end this. My responses. And I just want to talk about this because it came about it recently, and I was wondering to what scale that has been implemented or has been scaled up in Nigeria. So this is about having structures, which I've actually mentioned earlier, in which you have policymakers and researchers, being able to come together. Now, there was a pilot in Ebonyi State a few years ago, in the Ebonyi State University, in Ebonyi State. What they did was to try and work with the Ministry of Health, in the same state, and there was they call it a kind of exchange program in which researchers went to sit down within the Ministry of Health facilities, learning the language of policymakers, how to what do they want, how do they work, how do we develop policy briefs and things like that. And then the other exchange was with the Ministry of Health, focal persons, representatives coming into the university system, sitting down for about 6 months to actually learn more about research. Now, that exchange program was a pilot study, and the whole idea was to try and see how these two parties, the researchers and the policymakers, are able to think, from the other end of things, so that when you are talking, I understand where you are coming from. And this is a very good thing that I'm thinking that if I've not seen it, being done on a scale after that pilot, but it's something that we can think of, that researchers can sit more in the Ministry of Health, get to work with them. And then there is also these policymakers having programs to do in the research institute environment, academic environment, so that partnership, becomes natural, is flowing, and then the divide between these two interests begin to reduce. So that's just some of the, and I think Brian also mentioned something which I mentioned on the last note, and that was about saying that policymakers don't read. They usually don't read journals. They don't read your publications the way we researchers would read, because you need to know more, because you want to know how you're going to implement your own design, your own study. What they need are more summaries, things that are more like evidence dialogue. And I'm so happy. I keep speaking about Nisa, providing that platform. And I think it's something that we need to come on and start finding such avenues for exchange of ideas. So I'll just end on that note. Thank you.
Thank you so much for sharing that. I think in this last one thing that one of the common themes that came across all your responses was the need for co-creation, right? Participatory research. And that kind of reminded me of my early experience fresh out of grad school, feeling like I've made it in life, doing work with older Black men here in America. And of course, a newly minted PhD, I went to do community work with them. And I felt good with what I did. But at the end of the day, one of the older gentlemen called me aside and said, if you want to continue doing work in this community, you need to talk with us, not talk to us. And that kind of took me back. What does it took me a while to really make sense of what he was talking about. You don't just show up to our community and tell us, do this, do that, do that, do that, and expect us to listen. You have to come work with us to find what works, how do we make this sustainable? How do we implement this in a way that is beneficial to you and also beneficial to me? Because whether we like it or not, even as researchers, as we're doing our work, we have some benefit coming out of it. It's not solely because we want to change the world. Some of us get some things out of it. It could be promotion, publication, whatever it is. So co-creation is really very important, and participatory research as well is very important. I would like us to take a question from the audience, and then we get back to schedule. And the question is from Rebecca Jibola. She wanted to know, what are your thoughts about implementation science practice, and is there a place for it in closing the no-do gap? What is the no-do gap? Her first question, though, was, what are your thoughts on the place of implementation science practice? And then she sent an updated question with this. What are your thoughts about implementation science practice? And is there a place for it in closing the no-do gap?
I think I'll just say quickly, I think absolutely. I think it's been amazing to see the emergence of implementation practice as like a more formal thing, and formal roles around implementation facilitators or implementation practitioners in a variety of settings. And I think even in a university setting, we're seeing more people that are interested in that are training in implementation science and on the research end, but really wanting more practical applied tools for how do we actually move effective practices into routine care, and what kind of work can I do to be a part of that mission. And so I think there've been obviously amazing people worldwide who are working to promote that, and I think are really doing an amazing job of translating implementation science findings and what we're learning from sort of the evidence on implementation, and translating that in more practical ways to actually benefit communities. So I think that's I don't know what more to say than it's an essential piece of closing the no-do gap, as Rebecca noted.
Yes, Dr. Kim. Thank you.
Yes, I just wanted to add, I second everything that Byron has said. And I think we often talk about, and today we're talking about evidence-based practice as well. Like, we often talk about this notion of sort of research informed practice. And I think equally important, as we're noticing and going forward, really is this practice informed research that we need to move forward as well. I think that's really critical. And I think closing the gap, I'm really glad this question was asked, because I think the closer we can get to understanding where practice is really experiencing the implementation of evidence-based practices, we're able to do better research on it, and therefore the experiences and what the practitioners or the practice implementation science practice leaders are able to really share with those they are working with, but also with researchers to be able to move the field forward, I think is a critical piece that should continue to move the implementation science as a whole forward.
Thank you so much. Dr. Phillips?
Thank you very much. And just to add to what my co-panelists have highlighted, I just want to say that it's just the implementation science was just designed for that purpose of closing the no-do gap. That's just the long and short of it. And interestingly, if you look at some of the frameworks, that speak about, I mean, we have the implementation science, implementation research outcomes. We know that very popular frameworks by Proctor. And one of the key outcomes there is fidelity, right? Fidelity to how we do things. Now, I just want to use that key outcome as a kind of a play on words to say that to what extent do we fidelity is important, is an important component of implementation science, right? This is about how well you are there to, how you designed and plan to implement, a program or a project. Now, the question I will ask, and that's what I think we need to pay attention to, and I don't know to what extent researchers pay attention to this, is to how much do we pay fidelity to the rules and the guides of implementation science, because the frameworks are so well spelled out. They are so much clear. I mean, several years ago, implementation science was not so well defined, right? But now a lot of people have done a lot of work on implementation science. And now it's all about you just reading it up and understanding those processes. They have broken it down really very easily now. So the question I'm going to ask is, to what extent do we pay fidelity? This is an implementation outcome on its own to implementing our implementation research itself according to the guides and the rules. Because once you can follow the steps, just look at this. I just love so much the implementation research outcomes, about 6 or 7 or 8 of them. They're so beautiful that each of them is tackling a bottleneck, is tackling an issue that prevents evidence to be carried on into practice. Let's talk about to what extent do people accept what your evidence-based intervention. You can start with that. If they don't accept it, what are you doing? You go on to talk about the feasibility. If it's not feasible, what are you doing? So, and then you talk about adoption. So if you just look at all the way to sustainability, which we keep talking about, how sustainable is this, how sustainable is that. So if you can just weave all this into what we are doing when we are doing research, because all the components that also take care of the policymakers themselves, which we have been talking about as being an issue about adopting policy decisions. So I just want to say that this is so important. I'm happy for that question, which allows us to throw more light on the importance of actually paying fidelity to its implementation. Thank you.
Thank you so much. Dr. Onyeka, were you going to say something?
No, I was just rolling my thoughts on what Dr. Phillips was saying. Very, very crucial. I mean, if your research or your intervention doesn't have high or reasonable fidelity, I mean, it's of no use. So, I mean, those benchmarks, implementation science researchers should actually have them as like the 7 or 6 or 10 commandments and really abide by that. I think if we get along to looking at those benchmarks, then that would really help us ensure that most of our research is implemented and is sustainable.
Thank you so much. All right, so my next question is to the panel. Anyone can feel free to be the first to respond to it. All right, so we often hear the phrase evidence-informed policy. In reality, policy is also influenced by politics, budgets, relationships, and timing. How should researchers navigate this tension without compromising scientific integrity? I love this question. Anyone can go first.
So I will start. So let me take one component of the list, which is timing, right?
Yes. Yes.
So, and I'll relate timing to, I'm going to relate timing to political, to politics itself. And something called the political window, right? So this is a very important issue or factor that needs to actually be considered when you are trying to ensure that evidence is as adopted, by policymakers. Policymakers, most of the time, government persons are political in nature and by profession, and they usually have a very short period to stay.
Yeah.
Except they are dictators, So if they usually have a defined period to stay, 4 years, 2 years, depending on whether the position. And one of the advice or one of the guidance is that why you should consider your framing the problem that you want to engage the policymakers to be interested in, to try to build a solution and buy the solution is their interest. And that interest will also align with their timing. So if for instance, they talk about electoral cycle, think about election. If somebody can, he needs to stay on, the election is coming on, and you are bringing something that's very relevant, that if the policymaker can run with this, he can use this as a propaganda and tell the whole world that see how we are solving the people's problem. That is definitely going to win all people that are interested in the health of the nation, and that's going to buy vote. So I just want to mention that as just contribute to that part of timing and relate it to the political window, and trying to align that as part of the strategies to get a policymaker interested in what you are trying to sell to them. Thank you.
Thank you so much for sharing that. Any follow-up?
So I'm going to just say why Baron and Kim think about the answers to this. But I think I want to say, Abimbola, thank you so much for thinking about timing as a very important part of what you decide to do and when you decide to do them, how likely it's going to succeed. And I'm going to tell you just a little story of someone that wanted you to do, they've just been elected into office. And they call you and they say, these are my goals of what I want to achieve. They have a 4-year term. And then you sat down with them and said, these are the things I want to achieve during this period. And you take it down and said, we are going to provide you ways to be able to achieve those things, mechanisms to be able to achieve them, all your things there, and we'll put a team to do that for you, to be able to provide you the briefs and things and how to get to the point that where you're getting to. This is in the beginning of the 4-year terms. And this was some experiment we did. So we said to the person, if you start this process in the first term or first year of your 4 years, all our services will be free. If you start it in the second year, we will charge $100,000. If you start in the third year, we will charge $200,000. And if you start it in the fourth year, we will charge $500,000. And he looked at her and said, why will you say if I started in the first year, you'll be free? And if you started in the last year, you'll charge $500,000. So we said that because in the final year, we know you're not going to achieve anything because you're on your way out. So we just want you to pay us for the work we have done. And we know that there is not going to be anything. But if you actually started in the fourth year, that we are actually willing to volunteer that time to see an impact because we know that over 4 years, you are at the policy seat at the Holy, and you can push this along. Yeah. And he laughed and he said, and I will tell you what happened. First year, nothing. Second year, nothing. Third year, nothing. Fourth year, he calls us. Oh, you remember that stuff we discussed in Atlanta? I said, absolutely. He said, so are you going to be able to do that? We said, absolutely. He said, so when can we start? We said, as soon as you give us the check for $500,000. He said, but you said you were going to do it free. I said, yes, in your first year of election. So the thing I'm saying about this, just to portray what you're saying, is that the timing is very important. When people call you, try to work with you at the end of their time, when they've been around for 4 years, it's likely they're not going to spearhead and push for that because those things you are talking about, relationships, they are very important. if there is a marriage between what the politician or the policymaker, sometimes there's a difference between the policymaker and the politician, and sometimes they're the same. But when you have those marriage where what they are looking for is what you're looking to, the problem they have is the problem you're trying to solve, then you have an ally. So you're pushing there. I want to see that every child, every Nigerian teenage girl has HPV vaccine. And that's what they want to achieve. Then you said, okay, you have 4 terms, 4 years in this office. And this is how we are going to increase every year by 20%, so that at the fourth year, we would have increased coverage for HPV from 20% to 80% in your term. And you both organize these things. And every time you come in to present the result, the likelihood of your research being able to be implemented and so the policy being able to drive both is are better than if this was happening at the end of their 4-year term. So I think I do agree that timing is very important to be able to see when to implement it. But I've given enough time for Baron and Kim to think, so I am going to get off camera again.
Thank you.
I need even more time. So, Bo, if you have anything smart to say, please.
No, I think I'm really thankful for the important thoughts that have been shared. And I think it makes me really think, I mean, along the lines of timing, it makes me also think about how sometimes kind of the optimal evidence-based, solution may just not be politically achievable at that particular time. But there often are things that you can kind of intermediately be doing to sort of move the system in kind of a desired direction, building support for that broader change over time. So I think that's another way to think about timing as well. It may not be now, but I think the preparatory steps being taken now could potentially prepare for the system being able to respond when it's needed. I'm trying to think of like an example, like let's say I do a lot of mental health services research. So I think a lot about integrating mental health care, let's say, into more primary care settings. And the evidence may really support that type of integration, but because, full-scale integration might be really hard due to, let's say, workforce shortages or something like that, rather than just abandoning the effort, we may work with and co-create with policymakers by like training the primary care providers first and early mental health screening type of things, try to kind of establish a consultation type of pathway with specialists when it's possible, creating some kind of pathways through which outcomes can be tracked. So these are not immediate changes that are going to be implemented just because of the timing, because of larger sort of political or other contextual support that just may not be there at the time. But the initial steps may not represent the full cycle, but it is still kind of moving in the right direction that when the situation then shifts to a time when the evidence-based practice can move forward, that we are ready. We are ready together with also the partners and policymakers also being ready with us, having co-designed and co-thought through this process.
Thank you so much. Dr. Paul, was there enough time?
There wasn't enough time for me to say anything smart, but the only thing that I keep thinking about is sort of well, two things, but one is sort of basic of like, at least in the US, obviously this notion of like bipartisan engagement is kind of gone out the window. And so the notion of, not being afraid to talk to people across different political identities, I think is really important fundamentally. But I'm also thinking about like Greg Aarons and colleagues has this interagency collaborative team model, right? And the notion of like, hey, if we're in a system and we have turnover at multiple positions, sort of how can we build a broader coalition, spread the knowledge and expertise and people that are committed to the implementation effort across various stakeholders. And I think the same thing is probably true across, political terms and the like, is right. Like we're building partnerships with people that might be more stable within governments or within service systems that are less prone to turnover, and sort of spreading that across different people in a way that might be strategic. So I think there's maybe wisdom in that, knowing that some things could be eliminated with the stroke of a pen, and so I also am thinking on the negative side of that, with the eliminating things that have been built over years, is like, can we build those within systems that are less likely to change politically? So in the U.S. we had the National Repository of Evidence-Based Programs and Practices, for instance, that just went away overnight, sort of, but could that have been built in nonprofit systems or others? Or replicated in those settings that might be more stable. I don't know exactly what that will look like, but I think protecting investments like that, I think, could be really important.
Mm-hmm. Thank you all for sharing. And that's really a very good segue to the next question, which is, when evidence conflicts with political interest or institutional incentives, what tends to be the deciding factor in whether implementation moves forward? And again, anyone can jump in to be the first to respond.
I'll just say quickly, and I don't know if this directly addresses this, but I was thinking about it earlier in our conversation, partly around sort of co-production, or co-design, co-production, designing strategies, that whole sort of field. Like, I don't think we're very good about knowing how much is evidence, how much is intuition, how much is theory driven, how much is political, and how these different pieces weigh in. So I think as we delve into that, I think being explicit about like how we're making decisions related to implementation, not only what to implement, but how to implement it, is important. And this might be the complete tangent part of it, but from the co-production standpoint, I think actually, like, does that matter? Like, is it actually better to, solely rely on the evidence, or are practitioners' intuitions and sort of more atheoretical approaches, equally as effective, or do they need to be done in combination? And if so, how? Like, how do we weight these things? I think are important questions for the field. And I'll just note some really cool work by Natalie Taylor and colleagues in Australia that have sort of taken on these questions about evidence and sort of, or rather theory and sort of intuition-based approaches. I think more studies like that could be important for our field.
Thank you.
It looks like, and please correct me if I'm wrong, but it looks like maybe one of the questions in the Q&A may be touching on a similar aspect as the question that you just asked. Is that true? It's kind of about kind of the conflicting, you know, uh,
Yes,
politics
when
and how,
political
yeah, how
assets
to
and
know. So,
ethical accountability.
yeah, so I was just kind of thinking about both questions here, and in light of kind of Byron's response as well. I guess, I don't know, as implementers, we're kind of often thinking about being in this position of, needing to arbitrate between policymakers and then communities. But maybe, our role can focus more on, and this is kind of building on what Byron said about being clear, right? About being clear about what needs to be done or how to approach something. So I wonder whether sometimes our role can be less about kind of deciding which priorities are better, or how to kind of, arbitrate, but just help using the tools we have and the experiences and skills we have to be able to make clearer the consequences of making different choices. So I think it's not always that the community is seeing everything and the policymakers are not, or vice versa. It's not that the policymakers are seeing everything and the community isn't able to see it. It's rather they, I think, have different observable spheres. So thinking about like the constraints that the communities may not be seeing, but policymakers are trying to keep in mind, that could be budget limitations or other policy procedure pressures and different mandates they have to balance. And so at the same time, communities are also thinking about like lived experience and other sort of forms of knowledge that may not be as apparent to policymakers. So when seemingly priorities diverge, I think us with kind of our growing experiences and the tools we have at hand to kind of specify things and really systematically lay out what steps of doing something may be. Maybe we can apply that to create kind of a more transparent, if anything, understanding of sort of if you make this decision, then it may have these consequences given this kind of contextual understanding that we have. This party may benefit. This other party may bear some of the costs of that. And then that may lead to outcome A improving, but outcome B not necessarily being touched. So I think if we're able to sort of lay that out, it's less that we have to sort of play the arbitration type of a role, but rather bringing more clarity. And hopefully that can help bring forth a shared understanding of together where then the sort of shared priorities lie, where is sort of the optimal way to be able to move forward in light of knowledge that has now been shared more than before across the different parties involved.
Prof, you have your hands raised.
She
Yeah,
has some
thank you
hand
so
up.
much. Yeah. So I was looking at the question again. Is something that I've struggled over time to say, how do you differentiate policymakers from politicians? And can you actually do that? Because it does matter. I remember, and for someone who have been in not a politician but have been in a policymaking leadership role, and you recognize somebody said something the first day I landed in office, and he came to me as a director, executive director for the office, and told me that, one funny thing about us policymakers is that we will outlive you. That's what he told me. Said, you will be here for a period of time. You'll be gone. We have seen people like you come and go, and we will still be here. So if you're trying to do something, that it's better to work with us so that not only does the things change while you are here, but those change will outlive you. So it was very important when I went back to think about it and said, of course, in the 4 years of time that I have here, I can make these changes. I can bulldoze them. I can make them all the order that is done. But when I leave, do I want these things to continue? Because they have bought in to the policymakers, in quote, which are sometimes the civil service people who are there, and you who has been elected or appointed or whichever way you come in that leadership role. So I think when there is a conflict between the two, it's important to understand where the conflict is. Is the conflict with the politician? Is the conflict with the policymaker? And again, sometimes you can differentiate them because the politician is part of the policymaking, to be sure. But he's the one that's elected. He's the one that have the pulpit. He's the one that can. But he has one important goal. He wants to be re-elected. So he will do things that even him does not believe in because of that goal. Whereas the policymaker sometimes, who is not an elected position sometimes, who's a civil servant, have more ideological way to think about it. So when there is a conflict between the two, I think being able to distill down a little bit to say what is motivating those things. And one of the things I've seen people do here is actually, I remember somebody having what they call alternative community forums. So they had a community forum with the people who supported one view of that, and they had a community forum with people who supported a different view. And actually, they presented it. And it was, for me, earlier in my career, it was beautiful to watch the person that I was working with, who was at a very high leadership role, looking at those two things and trying to make a decision. of how do I make sure that in doing this, I do not alienate the other group, because they were all constituents that I wanted to keep happy. And finding them actually deciding on a middle ground of how to make those things work. So I think we don't always have to side with the community to say, oh, we are siding with the community because we all siding with the politician, but to try to find out a way to make the person who have the decision-making capacity to see from two versions and be able to tell them how. So just about how you can still accomplish something that makes people happy because it is in the right direction. And as Kim said, you may not solve all the problem today, but it is moving in the right direction, or maybe setting things up for a better decision to come. Thank you.
Thank you. Dr. Phillips.
Thank you. Thank you so much, Prof. Thank you, everyone. I think I can see Dr. Dalantine, I can see some questions. So let me take them.
Dr.
Okay, we've
Phillips is
actually
here to
answered
add
one.
his 2 cents to the discussion.
Okay, yes, go ahead. Go ahead.
Okay, thank you so much. And thanks for the question again. And I was just listening to Professor Eche, and I just like the way, it comes out with those practical situations, to really drive home these issues. And, it's unethical, like he was saying. So to talk about siding with side, it's not about siding with the people or community or siding with you're not siding with any other. It's actually unethical to side with the policymaker or a politician for selfish interest, against the community need. And so, and of course, you can't also side with the community, for the community, when you actually also know that this is a germane need, because they won't get things done. They don't have the power. They say have to go back to the politician stroke policymaker, which means that and just to say that these are the real critical problems and challenges, that's practical. And that's why it's not all a bed of roses, in easily really overcoming all these challenges. They are really practical challenges, and I don't think there is a straightforward solution to them. But then there are some tools, and we still need to use those tools to the best of our ability. And we talk about advocacy and we talk about negotiations. So, and I see from what Professor Iche was saying, he was really mainly talking about negotiation. It's about negotiation, advocacy plus negotiation. So you as a researcher, because you have studied, you have followed frameworks, you have used the right science to arrive at what should be done. So you know better. Sometimes you probably, because you also know that this is a community felt need. So, but then how do you get to the policymakers or politician? And that's where that skills has to come into it. Negotiation skills, advocacy skills, using networks, using influences. Who do we know? Who can talk? And that's where the power relationship comes into play. Power, influence, interest, stakeholders matrix come into play. Who has the power? For instance, that politician itself who is making things difficult, we might have somebody who he listens to. So that is, so the tools are there. So if we use these tools appropriately, you map out your stakeholders, you understand the influence and power interest framework very well, and you're able to bring them together and synthesize it to identify what the bottleneck is, you will have the best chance. Don't let me say you'll be able to. You will have the best chance at solving some of these problems. I just wanted to bring that keyword negotiation into the mix. Thank you.
Thank you. Thank you. Thank you so much. There's something that Dr. Phillips just reminded me of, and it's the dynamics of these conflicts. The researcher, the policymaker, the practitioner, and even the communities where they do this, the research is done. So the communities themselves. I think every bit of them have their power. And I'm going to say that, for instance, the communities, on Thursday, we're going to be sitting with researchers who have done a lot of work in communities, and actually some lived experience experts, because I think the lived experience is the power of the communities. They are going through what they're going through, and then you bring what you want, into their domain. They have a right, to say yes, and then turn your intervention upside down. So yeah, it's important that these conflicts, we take them and we solve them just as they come. And this leads me to another question in the Q&A from Professor Peter Anko that says, does social media space have a role in research evidence marketing to policymakers? So anyone's free to, everybody should, chime in here. So we'll start with Bo. We start with you. What do you think about social media and its the possibility of promoting? Yes, go ahead.
Yes, I have very limited experience with this actually in my own work. So I would love to hear from the other panelists here. But since you asked sort of my expectations or whether I feel like it could have impact
Yes.
in
Do you think
terms
it
of
can have an impact?
yeah, marketing. I think so. I think so. And I think the impact can be both good and bad. And I think it kind of makes a difference. Also, it makes I think it depends also on how much attention is being paid to social media in that particular time and space, and by the policymakers who the marketing is being done to. So I think when it is done in a way that is able to, I guess, still focus on what is at the core of the evidence that's being marketed, then I think it's helpful. Where the understanding or the comprehensive understanding is what it is and what it is not can be kept clear. Now, with social media, as some of us have limited to more experience, I think some of the ideas that are shared, it is very easy for those ideas to be skewed in one direction or the other. So I think if we're using these types of approaches to be able to influence and persuade policymakers, I think we just have to have the processes in place to be able to check for accuracy, processes to be able to check that indeed the integrity, full, appropriate approaches are being used for that.
Yeah, I think I agree with you. It could be, either way, good or bad. But Dr. Phillips, I know that your organization has a lot of experience, and you have are very visible in the social media space. So, what's your take on the role of social media in marketing the evidence that you produce to policymakers? And I want you to use Nigeria as a case study. Your organization's headquarters is in Abuja, and your research is nationwide. And so what's the experience you've had with the policymakers in Abuja, where your headquarters is, and trying to sell, like, this works? Let's integrate this. Let's make this a policy. What's your experience?
Yeah, thank you very much, Professor Tonya. So I'm just going to CIHP, we have a very strong, like you mentioned, social media presence. We have different handles, and we are constantly, posting our, our successes, our research findings, our, things that are very critical for the one to share with the science world out there. So we have dedicated teams that do this. And I will just refer to a current and ongoing a project that the CIHP is part of, a consortium, international consortium, in which it's called the Reach Out Project. And the Reach Out Project is also trying to drive, looking at how to resolve the barriers to immunization, zero dose challenge, across 3 countries, Nigeria, Rwanda, and Kenya. And we have partners from other countries, Italy, Switzerland, all of them working together. It's a very big project, about 4-year project. One thing that's very critical in that project is the plan. There is a deliberate and intentional plan to use social media as part of evidence translation into practice. So we've worked out that into, in fact, CIHP is even, is in charge of that component, that package, that work package under that consortium, to show you, our experience in that. And what we do, and I'm going to talk more about how we have used this in the States more than in Abuja, because the implementation of this project is in it's in the States, in 4 states, Gombe, Ondo State, Lagos, and Kaduna. So what we have been doing so far, because although we're still in the early stage we have not even done the implementation of the intervention. Right now, we're doing we are going into the next, we just did evidence generation. That's what we are trying to do, bring in, some preliminary assessment and barriers in the communities, amongst the caregivers, and then by health workers, health providers, and policymakers. And then we've done a lot of trying to synthesize what will be the next stage, setting for co-creation of intervention. Even with this early stage, every finding, every interesting observation from what we have done so far, we have handles, both on our own site and also at the State Ministry of Health handles themselves.
Wow.
So what we do, we don't just post on our own handles, we also encourage them to post this. So they themselves, those people who are going to take up this policy at the end of the day, they are already involved, even in the dissemination of the whole process from the beginning. So the states have their handles and they share it. When we're having meetings, they have come with their communications people from the state who will cover the whole event, who will put it on TV. So, and we have not even reached the middle of the project yet. And there's already so much knowledge, awareness, collaboration, ownership
and interest
of this project, and interest right from the beginning. So you can start predicting that this is likely to be successful at the end of the day, So just to share some of the way we have been using social media for this, for the evidence translation. Thank you.
Thank you. Thank you so much. Very vivid, a vivid picture of the very good and impactful work you're doing, and how you're using social media to share the importance of the work you're doing ahead of even just the beginning. You haven't even started the real implementation. It's really awesome. It's awesome. Thank you so much. So I think we are just a few minutes to the end of the hour. I would like to thank everyone for attending, but especially our panelists, Dr. Powell, Dr. Kim, and Dr. Phillips. Thank our moderator, Dr. Darlingtina, and thank everyone for being here since 4 p.m. West African time, listening to these wonderful conversations and engaging with their questions. Thank you so much. Two very quick announcements. So the first announcement is that we'll be having this is day 2, but we'll be doing a day 3 tomorrow. And our day 3 would also involve 2 very eloquent implementation scientists, one from the United Kingdom and one from Africa, Nigeria specifically. The second, that's our day 3. The second announcement I just want to quickly make is that please, we should rush to the Nigeria Implementation Science Alliance website, and we can see information about the 11th annual conference, which takes place from the 2nd to the 4th of September. And registration details are there. Please go there, ensure you register. We had a record-breaking number of abstracts this year in the 400 series. And very interesting, very difficult to even choose which was better than the other. So it promises to be it gets better each year. So it promises to be very, very loaded, very informative. It's a hybrid conference. So wherever you are, in whatever part of the world you are, you can join and be part of the Nigeria Implementation Science Alliance Conference. And with these few words, I want to say thank you, everyone, for for joining. See you tomorrow at 4 p.m. West African time for our day 3. And thank you to our fantastic panelists today for brainstorming with us and giving us a hope that things like incentives and things that have to do with the politics of around implementation science are things that we can easily walk around doing it the right way. Thank you so much. Thank you, Byron. Thank you, Bo. Thank you, Dr. Phillips. And thank you, everyone. And goodbye. And good night for those of us going to bed. Good night.
Yeah, thank you.
Thank
Yeah.
you.
Take care. Bye-bye.
Thank you very much, and bye-bye.
Thank you.